This podcast is intended for healthcare professionals, including dentists, for educational purposes only. It should not be considered medical advice, a product endorsement, or promotional material. Welcome, guys, to episode 4 of Decoding Dentine Discussions, the podcast where we explore the latest advancements and best practices in dentine hypersensitivity. I'm your host, Dr. Shaista Siddiqui, and today we have an exciting episode. This is about the team effort, the multidisciplinary approach to dentine hypersensitivity. Today we have got two guests joining us, Dr. Samira from Saudi Arabia and Dr. Aslan from Turkey. So Dr. Samira Osailan is a professor and head of the Faculty Skills Enhancement Unit at King Abdulaziz University and vice president and chairwoman of the Western Region Committee of the Saudi Dental Society in Jeddah, Saudi Arabia. Also, we have Dr. Aslan, who's a professor at Istanbul University, Turkey, and member of the Turkish Dental Association and the European Federation of Periodontology. Together, we'll be discussing the multidisciplinary approach to diagnosing and managing dentine hypersensitivity. But before we go into that, I'd just like Dr. Samira and Dr. Aslan to say a bit about themselves. So, Professor Samira, if you can just give us a slight introduction about yourself.
My name is Samira Osailan. I'm a Saudi woman. I'm oral maxillofacial surgeon. I graduated long time from King Saud University, and it happened at that time to be I'm the first girl or lady to be in my specialty. And then I went to King's College London and worked there, had my PhD and worked there for about 12 years, and back to King Abdulaziz University, where I'm academic and surgeon currently. That's me.
Thank you, Professor Samira. I'll go over now to Professor Aslan. If you could tell us a bit about yourself as well, please.
Thank you very much for your kind introduction. First of all, I would like to thank you, the Hellion team, giving me a podcast opportunity. So my name is Aslan Gokbuget. I am a full professor at Istanbul University, but I'm retired from the university. I have a private practice with my 3 associates. So my main concentration in my clinic is periodontology and implant dentistry. So I graduate from dental school 1982. Then I start my period training. So I became a doctor in 1989, 93 associate professor. Then I went to London. I got a scholarship from the British government. Then I spent 1 year a joint attachment with UCL. Then back to Istanbul University and became a full professor in 1999. And since then, I'm working at the university and my private practice with my associates. So today, we're going to talk about dental hypersensitivity altogether.
Yes, well, so I can see from both of your introductions, we've got a wealth of information between the two of you, wealth of experience as well. You both have been working in universities, helping train new generations of dentists as well. So your input on today's topic is actually going to be very important. This episode is brought to you by Halion, the producer of Sensodyne. Sensodyne with Novamin forms a protective layer over the exposed dentine areas to help relieve hypersensitivity. So before I start asking you questions, I just want to give a bit of a preamble. In June 2024, Halion and CAP hosted an international advisory board focused on the diagnosis and management of dentine hypersensitivity across the Middle East and Africa. In this series, we're exploring the key outcomes and clinical insights from that event, offering practical advice and evidence-based approaches to improve patient care. Today's focus is going to be very much on what is dentine hypersensitivity, pain associated with it, the management, the etiology. If you would like to get CPD points after listening to the series, you need to be registered on the Halion Health Partner website and open the podcast page on this website. So I recall you were both part of the advisory board in June, and one of the key aspects that was highlighted here was that that there's many interactions between different dental specialities. So I wanted to, if I'll start with Professor Samira. How important is it to have a multidisciplinary or interdisciplinary approach?
Well, it's very important that we have to consider all the speciality around us. So if I see a patient, we share so many cases together. So if the GP notice that the patient has an issue or pain who they couldn't recognize, they must refer immediately so we don't delay the diagnosis. That goes in any kind of conditions, not just dentine hypersensitivity. But my point
Absolutely.
here is that we should consider teamwork, and we should consider consulting each other. Is not a one-man show, is not something I should say, I can do it. No. When we do it together, the patient will benefit better.
Absolutely. Professor Aslan, what is your opinion on this? Should this be a multidisciplinary approach or an interdisciplinary approach, do you think?
Yeah, dental hypersensitivity is one of the most commonly encountered clinical problem. So it's a multifactorial problem. So, basically, we describe its exaggerated response to the application of a stimulus to expose dentine, regardless of the location. But this the multifactorial the reasons can be made this kind of hypersensitivity. So, first of all, we need to concentrate the cause of the problem. Then differential diagnosis is very important. So when we go through the differential diagnosis, so in this case, we need to handle the problem in multidisciplinary manner.
So one thing that I picked up in both of your introductions, you've obviously, Professor Aslan, you've worked in Turkey as well as the UK. Professor Samira, you've worked in Saudi as well as the UK. Do you find any differences in how people approached dentine hypersensitivity cases amongst the 2 or 3 regions? Can you expand on that? So I'll start with Professor Samira.
Well, it's when I was in the UK, I was focusing on my specialty and I was working in different units. But from my experience is dentine hypersensitivity in both countries, it's not easy to diagnose, and it takes some time because the differential diagnosis is a long list until the dentist will reach to the final diagnosis. But I think nowadays patients are very motivated and they know through the internet and their search. So when they come to you, they probably already will tell you exactly how they feel and what. But we as professional should take it very carefully to diagnose it and go through all the screening and the proper investigation. So I don't see a difference between the 2 country or the 2 schools in terms of diagnosing it.
Okay. Professor Aslan, did you have a different experience? I mean, your speciality is periodontic. So did you notice a difference in approach, how dentine hypersensitivity is dealt with?
I'm more or less, agree with Dr. Samira. I mean, when I was in UK, I worked in perio department. Of course, it's much more specifically treating this kind of problem other than Dr. Samira, because maxillofacial surgery is a different unit.
Yeah.
But the perio department usually having this kind of patient, but more or less the people are same. I mean, the problem in UK and in Turkey is pretty common problem. But luckily, in the past, for instance, we didn't have such as anti-sensitive toothpastes like Sensodyne at that time. But now we have this kind of solutions for our patients. But both of countries, as far as I know, it's pretty common problem.
Pretty common. Okay. How easy do you find it from both of your vast experiences communicating with other dentists, with other colleagues about cases? Is it easy to discuss cases, to be able to formulate a diagnosis? I mean, Professor Samira, your oral, maxillofacial surgery, I'm sure you would have seen some cases, or you would have seen, people having recession. Has it been easy for you to involve other?
Yes, when you are at the university, we are around each other, or the clinic and the specialty clinic in the same building, probably in the same floor. So it's not difficult at all to consult a colleague and ask when you have cases like this. My only issue is when the GP outside see cases like this and they don't take it seriously and they don't refer it or treat it early.
Thank you. Professor Aslan?
Yeah, in our department, patients usually were coming about not specifically, maybe a small portion of the people were coming due to the hypersensitivity. But in the past, we were doing lots of surgeries. Flap surgeries and etc. Of course, we were informing our patient after the surgery, the clinical crowns becoming longer than before. Then the neck of the tooth became exposed, so it will cause the sensitivity problem. But at that time we were not lucky because we didn't have so much anti-sensitive agent at that time. But nowadays we have actually. But the perio clinics are one of the major problem in perio clinics are this dental hypersensitivity, of course.
Thank you. So my next question is, why is dentine hypersensitivity not the remit of one speciality? If you could expand on that, Professor Aslan, if you could start first, please.
So I mean, the first of all, we need, before to start the treatment, we need to do an accurate diagnosis. Why did this happen? And we go through the differential diagnosis. So we need to identify why did happen to the patient. But usually in our perio department, what we do is we are trying to establish patients' oral hygienes and the proper toothpaste, toothbrushing, and regular checkups. Then if we couldn't able to solve the problem, then we go to different clinics and try to manage this problem. It's a conservative department or prosthetic department. Sometimes patients just coming, I mean, the dental clenching provocate this the problem. Then we refer our patient to the prosthodontic department in order to manage this kind of problem. So this is very important to make a proper and accurate diagnosis. then we can solve the problem. But since after we diagnose the problem, it should be, it could be specifically the peri department's issue, or could be a conservative department's issue, or could be prosthetic department's issue, and then we can supervise our patient like that.
So I feel with the different departments involved, communication, how we note what's going on, how we document everything, and how everything is communicated between the different disciplines is super important. Same question to you, Professor Samira. Why is this not the remit of one speciality?
As we said at the beginning, it's not easy to diagnose dentine hypersensitivity, and I've never seen a patient who come to me in the clinic and say, I have dentine hypersensitivity. It's always the typical scenario. The patient will say, I can't eat ice cream, I feel I provide, or I can't eat this or that. So once the patient tell you that they're not comfortable in eating or having very cold drink or having ice cream, they will draw your attention there is something. But again, from the rehabilitation point of view, if you are dealing with a patient, whether I will do extraction, or whether to do restorative, whether to do other treatment, we should be aware that this patient have dentine hypersensitivity, and we should monitor that. And we tell the patient, look, from what you're telling me, we will go through different process of investigation, but you have dentine hypersensitivity, and we advise you to use Sensodyne toothpaste, and it will give you a better feeling, because it's been done to treat sensitivity. So again, as Dr. Aslan was saying, it's never one speciality, but this kind of patient has to be looked after through us. And at the end, I will say eventually should be monitored by the general dentist.
Agreed. So I think that typically, if you're in outside of a university setting, that first port of call is your general dental practitioner. And I'd say it's very important for the dental practitioner to be very familiar of what they can do, what their limitations are, and when to involve other disciplines in helping to manage the case. One thing we found when the advisory board was conducted, and again, your experiences here will be very important, is undergraduate education. Diagnosis has to be taught to our undergraduates. They need to understand the theory as well as the practical aspect to this. So if you can, first of all, tell us, what do you think is lacking in the undergraduate education, and how important is it for undergraduate education to know about the dentine hypersensitivity? So I'll start with you, Professor Samira.
Well, I'm very passionate about this, because that's the future. That's what we should go. We have to get the student, get their head right. So we start teaching them from early, I would say from third year, when they start to know about all the dental subject. We have to explain to them, once they finish knowing the anatomy of the hard and soft tissue, then we explain to them the importance of dentine hypersensitivity in a very simple way. And then the following year, we will help them to, when they get into the clinic in our university, first exposure for our student is operative and perio. So the very first clinical courses where they touch patient is perio and operative. And this is where the opportunity, the golden opportunity, that we should alert them and to show them that if the patient complain to you about cannot eat ice cream or cannot drink cold water, and they stop that, but they don't know why, as a student, they probably don't know. They will but we are supervising them. This is our important role as academic and teacher, that we should alert the student that once you hear a complaint from the patient, we should take it further, help them to find the diagnosis, help them to reach this is a dentine hypersensitivity. It will take some time, and the differential diagnosis is long, but we should alert the student as the early stage. You know, when we teach them a lot about the early diagnosis of cancer, we focus on that, and it's very important, of course, and we do both.
Yeah.
It's the same story here, but we do it considering dentine hypersensitivity, and take it stage by stage until when they're final year, they should know how to diagnose and how to manage. So when they go out to the rest of the world, they can deal with it. They probably don't need to refer it to specialists. They can diagnose it and manage it. And that's, I think, the very important message here.
Agreed. That's very true. Professor Aslan, what are your thoughts on how important undergraduate education is for dentine hypersensitivity?
Dentinal hypersensitivity is a pretty common and unpleasant feeling for our patients. So the awareness is one of the most important issue. So the more dental professional aware of this problem, then patient could get the most efficient therapy. So undergraduate students must have comprehensive information about dental hypersensitivity. For instance, we are teaching in perio department, we are teaching our undergraduate students how to raise flap and how to suturate and etc. But we don't usually mention them the consequences of the this kind of surgery. So one of the most important and obvious consequences of this kind of surgeries is the neck of the majority of the teeth became exposed to the mouth. So it gives patients lots of discomfort during the healing period. So that's why we need also to teach how to undergraduate students solve this problem. And as Dr. Samira said, usually patients are not coming to our department due to the dental hypersensitivity. They are just mentioning that I cannot eat cold, hot things or sour things.
True.
It's caused me pain, etc. So we need to teach our undergraduate students how to solve this problem, and we need to also give opportunity to them what kind of material we have in our hands. So
yes,
so of course as I told before, we are pretty lucky. We have lots of anti-sensitive toothpaste available in the market now, such like Sensodyne, and so we need to also show them this kind of product, how to use it and how to a patient use it, and etc. So definitely we need to put classes maybe from the beginning of third year, but definitely every year each of the department have to be a proper program about the dental hypersensitivity.
Can I add here one point?
Of course, please do.
I don't know if the question is coming up, but my point is I don't see it's enough currently teaching dentine hypersensitivity in the undergraduate, because I was a member in the curriculum review panel. My suggestion is to all universities to add a bit more and make it as a clinical requirement, maybe 1 or 2 cases of dentine hypersensitivity throughout their clinical training. So, and the student, when they have clinical requirement, they take it more seriously. It's not just attending lectures. It's not enough.
Agreed. I think that's a good way to learn. They'll be forced to learn, and they'll need to know it. I mean, I don't know if you'll both agree with me, but looking back at my undergraduate years, I remember second year and third year. Second year, we were doing a lot more dental theory, and I felt, that was the correct time to learn about the oral biology, the theory behind dentine hypersensitivity. Then in third year, as we started to get exposed to patients, see patients, I feel that would probably be the best time to, have a more holistic approach where we start screening patients, not just wait for them to tell us, oh, I'm feeling pain on having ice cream, or it hurts me when I drink this, having being taught a more holistic approach. Because I remember from undergraduate training, doing cancer screening, it's second nature to me now. It doesn't take me that long, but it's because I practiced it on every single patient as an undergraduate. So had I been taught a screening method, having the one question, asking a patient, do you get any pain on eating certain foods? And then again, screening them for hypersensitivity, it would be second nature to me right now doing this. What are your thoughts on this about how we teach our undergraduates to screen for dentine hypersensitivity? I'll start with you, Professor Samira.
Just one thing to say before I go. Third year, it's similar to second year in the UK. So in Saudi Arabia, it's 6 years, the program. Yeah. So when I say third year is when they start to take all the dental subjects. Oh, wow. Okay? So they take the theory, all the theory about it. And this is very important to go through the etiology, the differential diagnosis, to learn the theory of the condition. Fourth year, when they go to clinic, and they first, as I said, the first two clinical courses when they start touching patient is one a perio course and an operative course. And this is for me as an academic, this is the exact important course and time where you teach them well, because they already had the theory. You remind them with the theory and then show them in the clinic. Try to get clinical cases of dentine hypersensitivity in the perio course in the clinic and tell them about it. When they go fifth and sixth year, they could search themselves for dentine hypersensitivity condition and have it as a clinical requirement. Not many, as I said, because patients don't come with the solo complaint. No, they will have other complaints. But students should be taught and should be clever enough to spot it and find it. And that's, I think, my opinion, where they will take it more, I would say, seriously and professionally, that they should learn how to diagnose and manage dentine hypersensitivity conditions. This is my opinion.
Thank you. Professor Aslan, do you have anything to add to this?
Yes. Actually, we are trying something now. It's pretty new. One of our old residents now, she's now teaching at the University of Kocaeli, is near Istanbul. Actually, they are doing like this. I mean, they are doing some kind of a scenario. So in the class, one student became a dentist and the other one became a patient, and they are following the scenario. The scenario is like this: the patient complaining about the dental hypersensitivity, and the other student asking a lot of different questions, but it's interactive. Meanwhile, the other students are giving some hints and ideas about what's going on, but it's 10-15 minutes like a theater, okay? But at the end we realize that it's very, very effective way to explain a problem in the clinic to the students, because didactic telling the story is I mean, they don't remember at the end, but this kind of theatrical things, they never forget it. Actually, we had very good experience with her. Now we are trying now to establish this kind of scenarios, different dental problems like
I think it's a great way to learn to understand symptoms, signs and symptoms, which then helps you refine your diagnosing skills, really. So I think that's a fabulous way of learning. I'm just curious, again, considering your respective countries that you're practicing in, are there any barriers to dental health care for patients? I'll start with you, Professor Samira.
No, in Saudi Arabia, the healthcare system is pretty good. So patient can access their dentist easily. And there are now so many private practice again. And
Easily.
we
Okay.
have
And Professor Aslan?
Yeah, we have some dental clinics. I mean, other than a university, but patient can easily go there. Also, the private practice they can go. But if they go to the private practice, of course, it's not including their healthcare protection. So they need to go to university hospital, either to university hospital or the public hospitals.
Okay, thank you. So I'd like to talk about what is current best practice, tools of prevention, implementation, and simple, effective things that can be done to help prevent or control dentine hypersensitivity. So, Professor Aslan, what is your current best practice for dentine hypersensitivity?
Yeah, of course, there are various treatment modalities available, which can be used at home or maybe professionally applied. So at home, desensitizing agents include toothpaste, mouthwashes, or chewing gums, and they act either occluding the dental tubulus or blocking the neural transmission. So this is the way is the first step. The conservative way to using this desensitizing agent like toothpaste. So the Halion has variety of desensitizing toothpastes like Sensodyne. So my approach is to first proper oral hygiene, proper brushing, and the correct tooth paste and the brush. Usually patients are using, for instance, if they are smoking or something like that, they prefer to use the hard toothbrush. So it also causes the hypersensitivity. So my approach is to change the patient's habits, behavior, and add some desensitizing agents, including toothpaste or mouthwashes, etc.
Thank you, Professor Aslan. Professor Samira, would you like to add to this?
I agree with Dr. Aslan. The most important thing for me is in my culture, I noticed that people use hard toothbrush and they go aggressive on themselves, on their teeth. So this is one of the things is very important to alert our patient in my country that they should be gentle when they brush their teeth, show them the right technique, and tell them about using the desensitizing agent, as Dr. Aslan was saying, and the Sensodyne is one of those. And I think that's it. So I will take it 3 steps. I would say, show me your toothbrush and how you're brushing. And 90% of the patient, they don't do it the proper way. And I tell them the right toothbrush, right size and right bristle, and show them the technique, how to brush, and then tell them the right toothpaste. And monitoring is very important.
So I've got a Absolutely, yes. Recalls and monitoring, absolutely incredibly
Yeah.
important. So from the
Yeah.
answers you've given to this last question, the regimens, the preventions that you both have mentioned, and also, we've been talking about undergraduate education. I feel like, this prevention is something very important that should be tied in with undergraduate education, where we can use our undergraduates to educate the masses, right? Going out there, doing workshops, or, when patients come in, use them as our resource to help educate people. Because in one of the previous podcasts, one of the big factors that has been highlighted is patient awareness. They'll have hypersensitivity, but they're not going to mention it because they don't feel it's that important, or they learn to cope with it. They try and guard from that area, eat on or drink on the other side. So educating people is very important. And equally, I feel our undergraduates, obviously they're monitored by seniors like yourself. You're supervising them. We need to teach them about filtering patients. Sometimes when patients aren't aware, things can get really bad, and it gets to the point where they might need surgical intervention. So our undergraduates need to be taught how to filter these patients and send them to the correct modalities. What is your opinion about this, Professor Samira?
Well, I always say the young are the future, and I do lots of TOT workshop. If we train the young, they are our voice. They're the one to go to the community and increase the awareness, make sure prevention is the most important thing. So again, we should include it in our community service. I do lots of community service through my position in the Saudi Society and through the curriculum. So again, when we mentioned earlier about having the comprehension of having dental hypersensitivity in the undergraduate curriculum, we definitely have to have the prevention bit there and emphasize on it. And I will go back to my very first statement when I said, as we learn about early diagnosis of cancer, I think we should take it that way, because until now, I don't see the dentist and take it seriously. But we as a senior and as teacher, once we teach them that, and they will do it, they will learn it. And that's my view.
Mm-hmm. Thank you, Professor Samira. Professor Aslan, would you like to add anything?
Yeah, for my country, so we have a problem in Turkey, because in Turkey, postgraduate education is not a conditional thing. So I mean, this is not a government forced thing. So of course, Turkish Dental Association are giving the opportunities, this kind of things, but it's not a conditional. So that's why some part of our colleagues, for instance, they graduate 10-15 years ago from the university, but not attended any scientific meeting or education program or program or the workshops and etc. So their knowledge stays there when they graduated. So we also need to, in Turkey, we need to focus on to try to attract them to come this kind of scientific meetings and little bit help them to awareness about this kind of problem. So this is the most important issue. That's why I'm focusing and insisting on to put this kind of problems into undergraduate program. So it's crucial.
Absolutely agreed. So I would say it's a little bit of a cheeky and maybe a difficult question. So you both, as mentioned previously, you both were part of the advisory board in June. I think we all learned key things from that advisory board. Today we've been talking about the multidisciplinary or interdisciplinary approach and undergraduate education. Since that advisory board, has there been have you changed your approach in any way with how you, so say for Professor Samira, how you deal with your undergraduates? Has anything changed? What were your key take-home messages from the advisory board, and how have you implemented that in your university setting? So I'll start with you, Professor Samira.
I wish the decision is mine, but it's not. But what I said to my colleague who was giving the lectures in that topic, please don't just give a lecture in dentine hypersensitivity. Give it a bit more attention. And my only way to pass in the message is my team, the young one. I have 40 boys and girls who help me every month in this continuous education activity I do through the society. So I say to them, did you learn this? How far do you know? And then we have a discussion among each other. But again, I will repeat what I said earlier. We have to emphasize more and add a bit more of clinical practice of dentine hypersensitivity condition into the undergraduate curriculum.
Thank you, Professor Samira. Professor Aslan, have you implemented anything from the advisory board in your practice?
Yes.
I liked the role-playing thing that you discussed about symptoms and so on.
I'm regularly conducting soft tissue management courses 3-4 times a year. So after the June meeting, actually, I did two times in Istanbul, the soft tissue management course. But now the difference is now I put in the course is the managing of dental hypersensitivity. So it's specific. Amazing. I am focusing not surgical way, but the conservative way. So what I did is I explained them is the dental hypersensitivity is an issue in our profession. So we need to properly manage this problem. Then now I put at least 10-15 slides about dental hypersensitivity in my surgical course. This is what I did.
Perfect. No, I mean, I think we all had our own key take-home messages. I've certainly changed how I practice, and my emphasis is very much on prevention. As I mentioned, oral cancer screening could become so naturally. Now I'm trying to make this a part of my screening process, making my approach more holistic as well. So no, this is all incredibly important. Thank you both, Professor Samira and Professor Aslan, for your inputs today. It's been enlightening, and I hope everyone who's listening, whoever the colleagues are, whatever level they're in, I hope they have something to take away from this, and I hope they contact us if they need any help, any advice on how to make this a part of their screening routine. We'd love to be able to help them. So thank you, both of you, for being a part of this. I just wanted to summarize, in today's episode, we've talked about the importance of a multidisciplinary or interdisciplinary approach to managing dentine hypersensitivity. We've highlighted that dentine hypersensitivity is a multifactorial condition requiring collaboration amongst specialities. Initial steps often involve periodontal treatments and improving oral hygiene. This can progress to conservative interventions like fillings or mucogingival surgeries if necessary. Comprehensive care also includes addressing lifestyle factors such as diet and teeth clenching. Our discussion today also covered gaps in undergraduate dental education. Whilst dentine hypersensitivity is common, many dental graduates lack the confidence to diagnose and manage it effectively. Experts stress the need for a more robust curriculum that includes prevention, diagnosis, and management. Ideally, this could begin in the second or third year and incorporate diverse teaching methods like case-based learning as they start seeing patients. Finally, the best practices for dentine hypersensitivity management were outlined with a strong focus on prevention, regular oral hygiene education, the use of anti-hypersensitivity toothpaste, and addressing habits like smoking and clenching were highlighted as simple yet effective tools for reducing dentine hypersensitivity prevalence and improving patient outcomes. So once again, thank you everybody for your input and look forward to seeing you on the next podcast. Thank you, Professor Samira. Thank you, Professor Aslan. It was a pleasure talking to you.
Thank you very much, Shaista. Thank you.
This episode is brought to you by Halion, the producer of Sensodyne. Sensodyne with Novomin forms a protective layer over the exposed dentine areas to help relieve hypersensitivity. If you would like to get CPD points after listening to the series, you need to be registered on the Halion Health Partner website and open the podcast page on this website.